days of life left in her. It just, again, breaks my heart knowing that they're just being left in their rooms, being left to unfortunately succumb to this dreadful virus.
This man's mother is a resident of a Toronto care home hit by COVID-19. She now has the disease. Retirement and long-term care homes continue to be devastated by this pandemic. More than half the deaths in Toronto have occurred in those homes. One in Etobicoke has seen more than 24 COVID-19 related deaths. And for family members of residents with the disease, it's now an agonizing wait to see if they will pull through. Linda Ward has the story.
Funeral home vehicles arrive at Eatonville Care Centre twice through the morning to collect the deceased. The grim scene familiar to some. This man's 89-year-old father died at the home on Sunday.
I was getting ready to come see my father. My brother gets a phone call telling me my father's not doing well. This is the first time we've heard of it. I get here, I finally get in. My father's on his last breath, literally dead, lying in his bed. So I went for 3 weeks thinking my father was fine. He's not, he's dead.
Henry Tomaszewski visited his mother at the home every day for 14 years. She's now fighting for her life in hospital alone.
I Skyped with her and then I realized that she was in really bad shape and notified my brothers. Me and my brother came, visited her, and she was just laying in bed with a little oxygen hose. I don't understand why there was such a delay in notifying family members that, their loved ones are in such grave danger.
Last week, a robocall from the home notified families that 14 people had died from COVID-19. That number has now jumped to 27, with 53 others infected. The center's executive director says now that the province intends to test everyone in long-term homes like these, they hope to get a better picture of the outbreak. And she says several residents of the home are symptomatic but have not yet been confirmed to have COVID-19, so they can expect that number to rise. In the meantime, though, she says staff are focused on containing the virus. But family members are focused on trying to get information on their loved ones inside.
I understand they're understaffed and the whole bit, but they need to contact the people whose family members are dying.
This son couldn't get in, but wanted to show his 93-year-old mother she's not alone.
Today I got lucky and I got through on the phone, and the wonderful staff were kind enough to get my mom to the window so I could give her a wave and just kind of give her that bit of reassurance.
A simple gesture for those who can do nothing more now than wait and see. Linda Ward, CBC News, Toronto.
The Premier says long-term care homes are quickly becoming the front line in the battle against COVID-19, adding that's why Ontario is launching a new strategy to fight the virus in these locations.
And tonight, we'll issue a new emergency order that will ensure every employee in these long-term care homes can only work in one home.
Allowing employees to only work in one location will hopefully prevent the virus from being spread from home to home. Ford is also ordering that hospitals which haven't seen a surge in COVID-19 patients redirect staff to homes struggling with an outbreak. Also, new infection control measures are being put in place, and specialists will be going into long-term care homes to ensure they are prepared. The Premier says the new plan includes money to cover additional staffing needs. He reiterated that the government's top priority is to enhance testing in these homes. And the Toronto Hospital is also dealing with a COVID-19 outbreak tonight. St. Joseph's Health Centre near Hyde Park confirming the outbreak in the intensive care unit. A patient who had recently been in ICU was confirmed positive over the weekend. 2 staff members who were in contact with that person also tested positive. The hospital says the staff members are at home and doing well. Other patients who were in the ICU at the same time have been swabbed and tests have come back negative. Treating patients with COVID-19 who need to be put on a ventilator is putting a strain on the supply of some crucial medicine. Queen's Park reporter Mike Crawley now with the steps the province is taking to make sure hospitals don't run short of these drugs.
Put a patient on a ventilator, the machine is only part of what's required. Certain drugs are crucial to sedate and immobilize the patient.
We need to take the human being out of the equation so the machine and my team can do the work they need to do to help prevent the respiratory failure from worsening.
COVID-19 patients use these drugs at double or even triple the rate of other ventilated patients, and that has Ontario hospitals eyeing their stocks with concern.
It's becoming increasingly apparent that some of the most essential medications that we require to provide mechanical ventilation may also be in short supply.
Doctors say the medications that they're most worried about are 2 sedatives and a neuromuscular blocker called rocuronium.
The whole world wants these same medications to provide the same therapy. So this is a real concern.
At the rate that COVID patients consume the drugs, the current national supply will only last a month or two, says this hospital pharmacist.
These patients who have COVID are requiring more of these medications when they're being ventilated, and they're requiring ventilation for a longer period of time. So there's kind of a dual pressure there.
Medical sources tell CBC News that the province has established a task force to do 3 things related to these drugs: to figure out the existing supply at hospitals, to develop guidelines for conserving the drugs, and to arrange for future shipments.
We're prepared to go and negotiate with other countries as well to get the active ingredients that we need in order to make these medications, because we know that there is going to be demand for them.
The hope is that physical distancing measures will slow the spread of the virus enough that there's time to build up the drug supply.
The longer we can give the health system the ability to ramp up production and to be able to cope with this potential surge in patients, the better off we'll be.
There's potentially good news on this in the latest provincial stats. The number of COVID-19 patients on ventilators is far fewer than projected 2 weeks ago. Mike Crawley, CBC News, Toronto.
Some MPPs returned to the legislature today in order to extend Ontario's state of emergency for another 28 days.
Well, the number one priority, this is a health crisis, and I'm not going to jeopardize people's health to open up the floodgates. I'm just not going to do it until we start seeing the curve go down, and it's absolutely essential that we continue on with the path that we're going.
That means the government would retain power to keep public and private facilities closed, as well as ban gatherings and prohibit travel in order to ensure proper physical distancing measures. Only 28 MPPs were at Queen's Park today. The provincial state of emergency was first declared back on March 17th. The Premier also announcing today Ontario's students will not be going back to school on May 4th. Doug Ford said it doesn't mean the school year is cancelled, adding Education Minister Stephen Lecce will have more to say about this in the coming days. At the same time, MPPs meet to extend the state of emergency in our province. A conversation was happening about getting back to normal in Toronto. Alicia Son has more on what the new version of normal may look like.
The reopening of Toronto is going to be a gradual process.
Because of course our continuing preoccupation, yes, has to be to get the economy open, get people back to work, get as normal a way of life reestablished as possible, but do it within the context of keeping people healthy and making sure that we manage something that won't just go away overnight.
And if we look to some global examples, it's not like things just go back to the way they were. Lockdown was eased this week in Austria, where you'll see a lot more people wearing masks. Others are going about their daily lives in some parts of China. Businesses have reopened in Wuhan. 4 months after total lockdown, people are going to the mall, but not before being screened for COVID-19. What's the new normal day-to-day going to look like here? A lot different without our local businesses.
This is a new era for all of us, and we have to figure out how the hell do we continue our business.
San Remo Bakery in Etobicoke has been closed for a month while they move their business online. And when they do reopen their storefront, things are going to be different.
The customer doesn't touch anything anymore.
Another harsh reality is many businesses might not make it.
So we polled the people who've signed up to Save Small Business and asked them, given the supports that exist today, how confident are you that you're going to make it if social distancing lasts into June? And only 35%.
The Save Small Business Advocacy Group started a petition to get the government to do more than offering up loans. It's been signed by over 30,000 small business owners across the country.
You know, if a landlord were to waive rent for 3 months, the government should pay that landlord 2/3. So the landlord does lose something. They lose a month's rent, but it's a sharing of the burden.
The federal government is expected to announce new measures to support small businesses this week. Meanwhile, the city is working on its own recovery plan based on advice from Toronto Public Health. Two things that will determine life after COVID in the Six. Ali Chiasson, CBC News, Toronto.
The Ministry of Education also working on their plans for the future. So with students having to learn at a distance for even longer than the government first anticipated, that is making things difficult for thousands of families who don't have the right equipment at home. Chris Glover joins us live now with more on this. So Chris, how many families are we talking about here who are in need?
So the Toronto District School Board sent out a survey late last month asking families if they were in need, and roughly 29,000 families in the city responded saying that they needed things such as laptops. And it's not just the TDSB. Other school boards, including Peel, are doing the very same thing. And tonight there is a massive effort to get the devices into kids' hands who need them.
Ahmed Al-Shantout says he's turning from dad to diplomat, managing his boys' learning on one family laptop.
I am concerned about their learning. We want their learning not to be affected by this situation.
A recent immigrant, he struggles to pay rent, let alone purchase a laptop for each child. His kids are on a list to receive equipment like some 15,000 others in this Toronto area school board. Photos provided by boards show a massive mobilization effort underway across the country to collect, tag, and distribute devices to kids in need.
I've reached you in Pickering today, right?
Yes, Pickering, rural Pickering to be exact.
Rosette Ocala says she's paid hundreds of dollars in data overage fees for her 12-year-old's e-learning. He connects using her phone's hotspot. She says the pandemic is spotlighting rural Canada's spotty internet access.
It's not even a matter of privilege or a matter of, a want. This is a need.
Schools are shipping internet-enabled devices. In Toronto, thousands of iPads will go out already connected.
We wish we could do this immediately. We wish we could have it done yesterday. But because we will be serving approximately 29,000 families, it just will take time.
Private businesses are helping. This warehouse packed with 1,000 laptops to be donated to students.
We are part of this community. We can't keep the government doing all the efforts alone. We all in this together.
One of these devices may very well end up with the Al-Shantouts.
So if that lasts, this means my first kid will graduate from high school during this time. So this is why we really need to make sure remote learning will not be affected.
Every board's top priority is equipping grade 12 students in danger of losing their final year of high school.
So grade 12 students at the top of that priority list. Then the TDSB will rank other students based on need. And finally, devices will go to families who have more than one child and therefore need more than one device. And in order to get all of this done, the TDSB had roughly 100 staff members working throughout this holiday long weekend, Dwight. And of course, most of those employees were with the IT department, but they were saying that this is a big effort for the division and an important one for the students across the city.
Yeah, very important that we get that level playing field for all these students so they get that equipment. Thank you for this, Chris. And Colette, the bad weather was good news this weekend because folks weren't tempted to get outside and enjoy it because it was a bit rainy, cloudy some days.
Yeah, for sure. So in a way, you're right, it kind of worked in our favor, right? I don't know if it's necessarily doing that now. We are looking at conditions where we're seeing daytime highs, now that this colder air has moved in, running about 5-6 degrees below seasonal. So this time of year, an average high in the double digits, 11, and today's high unofficially 6.4. You can see we're a little closer on those overnight lows, but those are going to be falling off on us as well. These are the current readings. Kitchener 3 degrees, St. Catharines at 5, everyone else sitting at 4 degrees, and these winds generally from the southwest turning a little more westerly, but it is lake effect in terms of what we're seeing with the precipitation. So the closer you are to the lakeshore, better the chance you're seeing these light scattered showers, but elsewhere it gets into a mix and then wet flurries from there where you see those areas in purple. And that kind of continues on this evening. Then overnight the winds let up a little bit, so we'll see less lake effect. It dries out. However, watch this. This is tomorrow morning. As we get into the later morning and afternoon, wet flurries come back through again as those winds pick up a little bit once again. So still some instability out there. And in terms of those cooler numbers, this evening 3 degrees, overnight -3 degrees, but feeling like -6 to -8. So these wind chills, they're not done with us yet. Tomorrow afternoon, there we go, running on the cool side, Dwight, once again, 5 degrees with some of that spotty precipitation moving through. I do have a warm up coming though, and I'll tell you all about that coming up.
Thank you, Colette.
You're welcome.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
A Peterborough student is calling for wider COVID-19 testing. This comes after she was turned down twice before being diagnosed with the virus. As Natalie Collada tells us, her symptoms were so mild she initially thought they were just allergies.
Hi, I'm Hannah. I'm 20 years old and I have been diagnosed with COVID-19.
It's not how you might expect someone with COVID-19 to look, and that's exactly the point.
It doesn't look the same for everybody, but you know, one person's mild case is another person's death sentence.
Hannah Abrahamsey was almost finished self-isolating after coming back from studying in the UK when she started to feel what she says felt like allergies.
I had a bit of a stuffy nose. I had a little bit of phlegm in my throat. I was sneezing a lot. I had headaches, but I get migraines, so I didn't even think of them as a symptom.
But it didn't go away. And with her brother and mother having compromised immune systems, she didn't want to take the chance it could be COVID-19.
I just had this feeling in my gut of, you know, what if I have it and I don't know, and I bring it home to my family? Like, it just, that I wouldn't have been able to live with myself.
She called telehealth, went to a testing center, but was turned away twice.
And I was told I don't fit the criteria even though I had traveled.
Eventually, her family doctor got her a referral, and Abrahamsey tested positive for the virus.
I was shocked. I was beyond shocked. Mainly, I was thankful that I hadn't gone home. There's much needed urgency for more testing. I was turned away for testing 2 times, even though I had travel history. So that I think is unacceptable.
She's now calling for wider testing in Ontario, worried people with mild symptoms like her could unknowingly infect vulnerable people. The province is hoping to increase its testing capacity to 8,000 tests a day by tomorrow and 16,000 tests a day early next month. Natalie Collada, CBC News, Toronto.
Some Canadian travelers are still trickling back into this country, having found a return home impossible until now. Today, the federal government stiffened the mandatory 14-day isolation restrictions they face upon re-entry.
With the updated order, any traveler arriving in Canada, whether they are symptomatic or asymptomatic, is forbidden to isolate in a place where they would be in contact with people who are vulnerable, such as adults of 65 years of age or older, and people of all ages with pre-existing medical conditions. Any traveler who does not have an adequate place in which to isolate or quarantine themselves must go to a place designated by the Chief Public Health Officer of Canada. This includes, for example, a hotel.
The tougher quarantine plan takes effect at midnight tonight. The government will cover the cost of quarantine in a hotel for those without an acceptable plan for mandatory isolation. Freeland calls it an additional layer in Canada's pandemic response to protect the health of all Canadians. After the break, some hard-hit European countries allowed certain businesses to reopen today, part of a cautious rollout to return to some sense of normalcy. We'll bring you that story next. The governor of New York State says he's starting to see some hopeful signs in the COVID-19 battle.
We think we are at the apex, on the plateau. The number of hospitalizations went up, flattened, continuing to flatten. Good sign.
Officials say 1,600 people were hospitalized yesterday compared to just under 2,000 the day before. The number of deaths, however, went up. There were 778 deaths in the state on Monday. That's an increase of 100 deaths from the previous day. Across the state, nearly 11,000 people have died from COVID-19. While Canada is still increasing pandemic restrictions, some European nations are now starting to ease them. Today, Austria, Spain, and Italy allowed some businesses to reopen as the number of new COVID cases across the EU continue to slow. Dominic Velitis has the details from home isolation in England.
Thousands of stores have now reopened in Austria. There is a plan, a timetable to all this. From today, non-essential stores under 400 square metres have been allowed to reopen. So too have hardware stores and garden centres. From May 1st, shops, shopping malls and hairdressers will be allowed to reopen, and if all goes well, restaurants and hotels will follow suit from mid-May. Public events are a different thing though altogether. They will not be allowed, the Austrian government says, until late June at the very earliest. Now, throughout, people will have to wear face masks in all shops. A more fragmented approach over in Italy, where parts of the country have decided to reopen bookstores, stationery stores and children's clothes stores. Again, strict rules will be in place, but some regions in the north, Lombardy for example, which is one of the worst hit, have decided to hold off for the time being, while other regions are taking a mixed bag approach. In Spain, meanwhile, where the majority of the population must still stay at home, people in manufacturing and construction are being allowed to return to work, but again, they must stick to strict safety guidelines. Looking ahead, Poland and France look set to be the next countries to lift some restrictions, and Germany will hold talks with regional leaders tomorrow to discuss the way forward. Countries across Europe, indeed across the world, are trying to work out their respective exit strategies from this pandemic. The challenge is to try and find the balance between rebuilding their economies and keeping their populations safe. And at the back of everyone's minds are those repeated warnings we've been hearing from the World Health Organization not to lift restrictions too soon, because getting it wrong could result in a second wave of infections. Dominic Velitis, CBC News, Bristol.
Amid a surge in infections, police checkpoints were set up on roads around Moscow this week, and 24-hour patrols are taking place to enforce new mandatory home isolation orders and implementing tough new measures to stop the spread. It comes after months of denials from Russia that coronavirus was a serious problem. Moscow is also introducing a system of passes to monitor and track residents' movements. Officials say there are more than 21,000 COVID-19 cases and 170 deaths in Russia, most of them in Moscow. President Putin said yesterday that the Russian army may be called in to help combat the crisis.
Frontline staff and healthcare workers say physical distancing isn't happening at all of Toronto's homeless shelters and that there needs to be urgent action.
It became an ethical imperative for us to also speak up and talk about what we're seeing from our vantage point.
I'm Talia Ricci, and coming up, the city announces an interim COVID-19 recovery site for people experiencing homelessness and explains why the process of moving people within the shelter system is complicated.
The coronavirus pandemic has forced one of Toronto's oldest pizzerias to shut down. Vesuvio Pizzeria and Spaghetti House in the Junction. Its owners announced on Facebook today the pizza shop will be closing down later this week for good. Vesuvio's has been around since 1957. I used to eat there in high school. It was the first New York-style pizzeria in Toronto. Their last day doing takeout and delivery will be this Sunday, April 19th. Many Torontonians are doing what they can to support local businesses, and today the city supported the launch of a new website that allows you to give financial help directly.
Toronto-based Distantly.ca is a free, secure community crowdfunding tool that enables Torontonians and Canadians alike to support their favorite local businesses during the time of crisis they are undoubtedly experiencing. These contributions help to alleviate some of the overwhelming expenses that these businesses have, like rent and payroll during tough times. And using the Distantly.ca directory, Torontonians can search for their favorite local businesses and securely deliver contributions in a few clicks.
Local businesses can visit Distantly.ca to set up an account for free or contact their local BIA for help. There are growing concerns about the city's homeless population during the COVID-19 pandemic. So far, there are 30 confirmed cases within 7 locations of the shelter system. An open letter was sent to officials asking for urgent measures to be put in place to stop the virus from spreading even further. Talia Ritchie has more.
Frontline harm reduction workers, shelter workers, drop-in workers have really been sounding the alarm on this crisis for a number of weeks now.
Sounding the alarm on crowded shelters where people are still sleeping in bunk beds. Many of the clients have chronic health issues.
It became an ethical imperative for us to also speak up and talk about what we're seeing from our vantage point.
And more than 300 other physicians and nurse practitioners agreed, signing a letter sent to government and health officials Monday asking for outreach testing in order to ensure there's physical distancing between clients and thousands of additional rooms to create space.
We've seen a small amount of movement. I think we need to see more, and I think we need to see more rapidly.
Today, the city insisted it's working as fast as it can, adding its distributed protective equipment, installed portable washrooms, and provided help to people living in encampments. Marianne Bedard admits physical distancing has been one of the biggest challenges in shelters.
Staggering meal times, delivering meals to rooms where possible, and staggering use of common areas are some of the ideas that we have shared.
Bedard says so far 1,000 people have been moved to hotel rooms and other facilities the city has created to make more space at some of the shelters. The plan is to move 1,000 more by the end of April.
Moving someone out of a shelter into a new space requires time and choice and resources, and most importantly, it has to be done with dignity.
But Rye says the measures healthcare workers are asking for can't come soon enough.
Every minute we're waiting has life and death consequences for people on the ground.
The city did say, as of today, an interim COVID-19 recovery site for people experiencing homelessness is open. And that will operate until the official recovery site with more than 400 beds is ready. That location will have support from Doctors Without Borders. Talia Ricci, CBC News, Toronto.
The charity Global Medic is trying to do their part during this pandemic, setting up field medical tents outside a healthcare center for refugees and immigrants.
You have to see your patient sometimes to know what's going on. You can't give a vaccination to a newborn. You can't examine a newborn. You can't assess a pregnant woman who's having difficulty without actually having them physically present. And this is a way to provide safe infection control care.
The goal is to provide a safer clinical environment for patients who can't be treated by virtual methods, giving patients another option visiting a hospital. The Canadian Centre for Refugee and Immigrant Healthcare is a volunteer-driven team of physicians, nurses, and other healthcare professionals who provide care to Canadian newcomers. Global Medic and the centre saw the need in both newcomers and the general population and are welcoming anyone who needs help to visit the tents. The group says they are expecting to set up more tents in the coming days. A team of volunteers, a part of the Stop COVID-19 campaign, delivered medical masks to hospitals in the GTA, including St. Mike's, Sunnybrook, North York Gen, and Markham Stouffville.
Today, we are delivering the first batch of 500,000 masks that we have ordered. And we are delivering 200,000 today to different hospitals, long-term care, as well as our neighborhood agencies in GTA, so that our frontline workers would be protected.
Another shipment of 300,000 masks will arrive in the next 2 weeks. The campaign hopes to raise a total of $2 million so it can continue to support healthcare workers through this pandemic. Organizers are asking anyone willing to help to donate. As Canada marks 1 month of shutdowns, self-isolation, struggles, and collective strength, we are marking it as well with a CBC News virtual town hall. Ian Hannah-Mansing and Heather Hiscox will host a 2-hour CBC News special on CBC television. It will be simulcast on CBC Radio and will stream on CBC Gem and our online platforms, answering your questions on the pandemic. Now submit yours to covid@cbc.ca. It is all happening tomorrow, Wednesday, April 15th. You can tune in at 7 p.m. Those are the sounds of the cleanup that's on the way in Port Dover. The area was hit by those strong winds that raced through the province yesterday. Homes and businesses were flooded while streets were left covered in sand, as you can see there. Because there was advance notice of the storm, some store owners were able to prepare.
What we did all day Sunday was we put 3 layers of plywood up with plastic and sandbags and locked it in, and it kept it at bay. It didn't keep it out.
We pretty much had the street to ourselves down here, so we brought in, we had a couple trucks come in with loads of sandbags, and we had tractors moving around, pretty much free of worry about customers and tourists and stuff.
The flooding, of course, comes on top of the pandemic, but the business owners we spoke with say they have had strong support from the local community and they plan to get back to normal as soon as possible. A lot of worry for these, especially small businesses during this time, Colette, to have to deal with the pandemic and this weather.
Yeah, when you get the floods on top of it, and even with some of the winds over the weekend, we had power lines down because tree limbs came down and brought them. So some real issues, and some of that flooding into southwestern Ontario around Leamington, Point Pelee, they continue to see issues there. And the winds are still strong, not as bad as they were on the weekend, but we are talking wind chills as this colder air is in place. And we're also still talking about wet flurries. We'll see those kind of off and on. I'll walk you through that. But we do get into a rebound when we get closer to the weekend in terms of our temperatures. We'll be coming back up and getting closer to seasonal, which actually highs in the double digits. So that's very nice. What's not so nice are these winds. Yeah, we're seeing some of these gusts up towards 60 kilometers an hour from the southwest there in Hamilton, strong in St. Catharines, and certainly back towards the Windsor area, and even in Toronto, still gusting over 40 kilometers an hour. So our current temperatures, Mount Forest has fallen below freezing at -1, but Toronto at 4, Oshawa as well, seeing 4 degrees now. As our temperatures drop all around into the negatives overnight tonight, that's when we start talking about wind chills, because it feels even cooler, and we tend to only do that when we're below freezing, at freezing or below, when we start talking about these wind chills. Now, have a look at this. You see the greens, areas where it's closer to the lakeshore. Yeah, it's more like some light showery activity through here. Then the pinks getting into a mix, and then these wet flurries. This is lake effect stuff that we're seeing. It'll ease off a little bit through the overnight because the winds are going to back off a little bit. But then we get into a repeat tomorrow late morning and into the afternoon hours, scattered in nature and very light as well, but still a little bit of precipitation coming back through. Those winds turning more towards the northwest and the westerly direction, so at least it changes a little bit some of the areas that see this. Overnight tonight, though, these are a look at your readings. Yeah, we're talking about -3 in Toronto. St. Catharines, you're faring a little bit better, as you often do, but -3 Mississauga and -4 in Markham. But here's what you need to know. With those readings, those cool temperatures coming close to those morning hours, as you're getting up, and if you are going to be making your way out, especially if you're some of our frontline workers, it's going to be a chilly start to the day, so -6 to -8. Tomorrow afternoon, kind of similar to today, if anything, even a little bit cooler with some of those light wet flurries moving through the area. And then I want to show you when we do get to the warmer air moving in. So it's not necessarily Thursday. We're faring a little bit better, 6 degrees for our high with that mix of sun and cloud, and still some wet flurries will likely show up in our skies again. Now Friday, this is encouraging. 8 degrees, and you can see still it's kind of variable skies that we'll be into, but Saturday sunshine, and there you go, 10 degrees. And we were looking earlier in the show, and an average for this time of year is 11. Well, how about that on Sunday? We get up to a high of 11 degrees. However, that's the next real system that's going to be moving through on Sunday. So as the cold front approaches, we are going to see some showers developing as well. Dwight?
Thanks, Colette.
You're welcome.
Former U.S. President Barack Obama broke his long silence today on the presidential race and officially endorsed Joe Biden as the Democratic Party's nominee. In a 12-minute-long video, Obama said the coronavirus pandemic has highlighted the need for better leadership in the U.S.
Choosing Joe to be my vice president was one of the best decisions I ever made, and he became a close friend. And I believe Joe has all the qualities we need in a president right now.
Obama's support will likely draw attention to Biden at a time when most Americans are focused on the coronavirus instead of this year's presidential election. It's also expected to help the former vice president's fundraising efforts. In his video, Obama also commented and commended Bernie Sanders and called for unity within the Democratic Party. Sanders publicly endorsed Biden just yesterday. After the break, no lineups, no theaters, but the show must go on. How Hot Docs is going to keep things going digitally. More for you to binge watch when we come back. Today, we are hearing news that the famous Cannes Film Festival will not go on as planned in France. And here at home, we are seeing creative solutions to keeping the Toronto International Film Festival in motion in some way, shape, or form. Same goes for the Toronto International Hot Docs Film Festival, which kicks off this week, albeit digitally. Yelena Adzik joins us now with more on this. I guess we want to start with the big opening night film that's set to air on Thursday, Yelena.
Yes. Okay, so Dwight, this one is called Made You Look, and it is just such a colorful story about art and about fake art. The actual subtitle is called A True Story About Fake Art, and I'm going to give you a little bit of a sense of it right now.
These works went into the greatest museums in the world.
But there was a point where questions were coming up.
The analysts found that a yellow paint used in the Pollock hadn't been available until 1970. Jackson Pollock died in a car crash in 1956.
Either the paintings are all real or they're all fake.
We all know how that story turned out.
All right, so that one's called Made You Look. Now, that is a story that is about what is pretty much considered to be the biggest art fraud in American history. So they started with something that is really just bombastic and big, but the Hot Docs Festival, it really is about so many different movies from so many different cultures. There's a lot of intimate portraits, looking at people with all kinds of human rights issues as a backdrop. So there really is a wide range. But in the meantime, the one that they've opened with, which I just gave you a snippet of there, Made You Look, that is directed by Barry Average. Now, this is a man who is very well known on the Toronto film scene. He is someone who, as an example, many years ago, Dwight, he created the first massive theater in Sick Kids Hospital. It was the first one that was ever done. And he really does care very much about the state of the industry, but also about how film can help people. So I had to ask him a question about this time that we're living in, right? With all these film festivals being canceled, we know about, you mentioned the Cannes Festival today. And, you know, I just wanted to ask him what his thoughts were about the future of us as people going to film festivals, being inspired. Is that going to happen? Have a listen.
Film festivals will come back. Will they come back in the same scale? No, we're all going to take a hit. Are people going to be comfortable sitting in a theater of 2,000 people or 1,500 people? Not initially. It's going to take a while. Nobody's getting out of this virus without scar tissue and damage, without a doubt. And that's not even addressing, you know, people who have lost their lives. From a cultural sense, there's going to be damage. It's going to take its time, but I'm optimistic.
You know, Yelena, he's such a prolific Canadian film director. I see him out downtown all the time. What is he saying about not being able to work during this time of social distancing?
Okay, the reason that's a great question, Dwight, is because he actually is working. He's one of the few filmmakers that's working. Believe it or not, before this all happened, he ends up working. He decides he's going to make a documentary about the life of Howie Mandel. Now, Howie Mandel is a well-known germaphobe, okay? He says he's got OCD. He absolutely will never shake anyone's hand. I'm talking about the game show host as well as the Canadian comedian and mentalist. And so this is someone who he just can't, Barry Average could not believe that he happened to be doing a doc on him when all of this happened. So he's going to continue making it online. Have a look.
Right in the middle of filming this documentary on Howie Mandel, we get hit with the virus, and which is so insane. As Howie Mandel says in the film, of all people and of all documentaries, and he literally says, "Welcome to my world." He's hopeful that the new world means that we're going to constantly wash our hands and maybe stay back a foot or two. I hope that it isn't a world of where we're not going to have the ability to, you know, to sense the heat that one gets from another in terms of social interaction.
Okay, so Dwight, you can hear there that he's hopeful film festivals will end up going on some way, shape, or form in the future. In the meantime, for the Hot Docs International Film Festival, you can check it out on CBC Gem. You just have to download the app. It's totally free, and you can watch all of these amazing documentaries starting on Thursday. So do give that a Google.
Good timing, because a lot of us have a lot of time on our hands to be watching some films right now. Thank you, Yelena.
See you soon.
After the break, today's frontline hero Stick around for that. We will be right back. A powerful tribute to healthcare workers became a bit of an anthem during Easter weekend. The song was performed by a group of doctors and has hundreds of thousands of views on social media.
We rise again in the faces of our children. We rise again in the voices of our song. We rise again in the waves out on the ocean.
The group of physicians decided to release their choir version of the song Rise Again by Canadian songwriter Leon Dubinsky. Since last week, it's received almost 300,000 views, both on Facebook and YouTube. It became so popular, churches and synagogues across North America even reached out to the group asking if they could play the video during their virtual Easter and Passover services. What a nice message from our frontline workers to our frontline workers. Effie Fanaris is being treated as a lifesaver by at least one of her patients. She's a respirologist at Markham Stouffville Hospital, and recently she helped Bonnie brazier and her husband, Tom, through a scare. This is Dr. Fanaris. She treats Tom for asthma, and late last month, she checked in on him and found he wasn't feeling well. She suggested he go for blood work immediately, and they found he had low hemoglobin and needed a blood transfusion. Within minutes, Dr. Fanaris had made the appointment. Bonnie says, needless to say, we were extremely nervous about going to the hospital with this virus and Tom's suppressed immune system, but there was no alternative. The hospital was so organized, clean, and efficient. If Effie hadn't been in constant contact with us, we would not have checked his blood as we were self-isolating. And the last thing we wanted to do was visit a lab or the hospital. It is truly a remarkable hospital, but Dr. Fanaris is our absolute hero. So, Dr. Effie Fanaris, thank you for everything you are doing. If you would like to share a story about your frontline hero, just send us a selfie-style video explaining why they are a hero to you. Tag us on Twitter or Instagram at CBC Toronto. Send us a message on Facebook or email us at torontotips@cbc.ca. Love this part of the show when we get to recognize these great folks out there, Colette.
Yeah, me too, Dwight. And I have another one to share with you. Yeah, this is another one about our frontline workers, essentially. But, you know, Mrs. Elizabeth Fraser was turning 100 years old this weekend in a seniors residence in Markham. How do you celebrate during COVID? Your family can't be there with you. I'll tell you how. The Markham Fire Department comes out and does a solid and brings in a couple of fire trucks, sirens blaring, lights flashing, and does a drive-by for all of the residents to enjoy and help Grandma Fraser turn 100 years old. There she is with her hat and eating her bunny cake, celebrating as well. And there's a personal connection for me. I had nothing to do with the fire department getting there, but that's my partner's grandmother as well. And she's got great-grandchildren too, Dwight. So really love that they would do that. The fire department was really lovely of them. And that's hall number 95, by the way. And let's just give you a quick look before I throw it back to Dwight of what's going on with your weather this evening. 3 degrees with still a little bit of light mixed precipitation. Mostly it's wet flurries we're seeing, but overnight, be prepared. We are dropping down to -3. We have to go back to this idea of talking about wind chills, so feeling like -6 through the overnight hours. And then tomorrow, we're going to see a return. So it's probably going to dry out a little bit through the overnight, and then tomorrow late morning into the afternoon, some scattered precipitation coming back, mostly again in the form of some wet flurries. 5 degrees will be the high tomorrow. But we're going to see that warm up, Dwight. Like I was saying, we're going to see that coming a little later as we get closer to the weekend.
Colette, the only number I care about right now is Grandma Fraser's 100. Happy belated Grandma Fraser, and a shout out to the fire department for helping to make her special day even more special.
So great of them, and Amica there, the home there in Unionville, were really, really helpful too, so that she could watch everything on an iPad and hear all the birthday congratulations for her. So that's lovely.
Well, hopefully she's watching right now. Thanks, Colette.
Yeah, thank you, Dwight.
That is our show for tonight. Thank you for joining us. Tonight, our 11 o'clock news program hosted by Mike Wise returns. He'll have your next local news right after the national this evening. We'll see you back here tomorrow night at 6. Have a great evening, everyone, and stay safe.